want to ask about inpatient versus outpatient treatment for substance use disorder. Everyone knows that people who are of higher net worth, people with really good insurance, often go to rehab, so to speak, right? They go to a residential treatment facility for a length of time. That kind of treatment is less available for people who are uninsured, people who are poor, people who are unhoused. Do you feel that New York could be doing more to offer inpatient residential treatment for people suffering from substance use disorder? What's the capacity issues we're facing, and what's standing in the way of that? And if you could have your wish, what would we be doing right now, federal, state, and city, to provide more residential inpatient treatment for people?
Thanks, Council Member, for the question. It's a really thoughtful one and an important one. I wish that anyone in New York City, regardless of income, race, ethnicity, neighborhood, could access the kind of bucolic treatment facilities and off-site supportive communities that people of means can access. That, just as a human being, as a doctor, I want all of my patients, most of whom are low income, from northern Manhattan and the South Bronx and Washington Heights, I want them to have that same access. The reality is we don't live in that world. Most of those treatment programs you're referring to are not Medicare or Medicaid reimbursable.
That's the IMD rule.
No, slightly different. The IMD rule is largely around inpatient psychiatric treatment, institutions of mental disease. Again, we've had this long-standing history in this nation of treating addiction somewhat separately to mental health issues, even though anyone doing this work knows that at the core of addiction is pain of some kind, right? Whether you classify it as a formalized mental illness or not, it's pain. It's self-medication for pain. And so I wish I had a good answer for you about how we solve it, but it starts, one, by recognizing that these are intersecting crises. And so as we talk about our second pandemic of mental health needs, as we talk about serious mental illness, as we talk about our youth mental health crisis, it's why I, in my agenda coming into this role, have included opioids explicitly in that agenda. And it's why I'm very proud to lead the health department, which is one of the few health departments in the country that actually not only integrates health and mental health, but that integrates substance use programming within that as well. And so I wish I had good answers for you. It starts with Medicare and Medicaid and actually paying for some of this, because right now it's all grant funded or private pay, which is why we see the disparities and inequities you mentioned.